Thank you for joining us on Journey to 600. Today we're going to be going over other systems and more specifically going over blood disorders. One blood disorder that you might come across while studying is hemophilia, and this is when blood does not clot. Common signs and symptoms include nosebleeds, gum bleeding or mouth bleeding, swollen joints, stiff joints, bruising, blood in stool or urine, coughing or vomiting blood, or even a heavy menstrual cycle. Next, we have anemia, which is a reduction of oxygen carrying capacity of the red blood cells. Common signs and symptoms include fatigue and low energy, increased heart rate, shortness of breath, headache, and dizziness. These are common because of that reduction of oxygen carrying capacity. So oxygen is not getting to your muscles, it's not getting to your lungs, it's not getting to your brain. Next, we have polycythemia. This is when there is an increase in the number of blood cells and concentration of hemoglobin. So, increase in viscosity and blood volume, which can elevate blood pressure. I have included a rather lengthy list of signs and symptoms that could be seen with this condition. The big ones to note are fatigue, headache, dizziness, bruising, and hypertension. But any patient could have any of the other symptoms as well. So I've included here two blood disorders on one slide because I commonly got them mixed up. So it's easier to see them side by side. So first we have thrombocytopenia and thrombocytosis. The big difference between these two is the way they're spelled and pronounced and their levels of platelets. So with thrombocytopenia, you have a decrease in platelets, while with thrombocytosis, you have an increase in platelets. I've included a picture in the middle to kind of give you a visual. As you can see from the picture, they both include a normal and then the low versus the increased platelet count. Here I've put two blood disorders on one slide again because they could get confusing due to spelling and how similar they are. So leukopenia is when you have a decrease in white blood cells, and leukocytosis is when you have an increase in white blood cells. So I've included a visual below, and it lets you see the difference in the red blood cells versus the white blood cells. So in the middle, you have a normal with, big white blood cells and then multiple red blood cells. To the left, you'll see how there's only one of those white blood cells. And then to the right, you'll see how there's more of those white blood cells. I think it's important to point out how patients with leukopenia are at a higher risk for infection. Okay, the correct answer is B. What condition demonstrates an increase in blood viscosity and blood volume? So A, hemophilia, that is when blood doesn't clot, so you're not going to have an increase in either of these. Then we have B, polythemia. You are going to see an increase in both of these due to the fact that this is going to increase the number of red blood cells and the concentration of hemoglobin. This also elevates blood pressure. Then we have C, anemia. That is when there is a reduction of oxygen carrying capacity. And then we have thrombocytosis, and that is when you're going to see a decrease in platelet levels. So with C and D, you're not going to see an increase in blood viscosity and blood volume. Okay, and for your last question, I had a little matching game just to kind of help get those really similar and possibly confusing blood disorders out of the way. So, with thrombocytopenia, you are going to have a decrease in platelet levels. Leukopenia, you're going to have a decrease in white blood cell levels. Thrombocytosis, you're going to have an increase in platelet levels. And with leukocytosis, you're going to have an increase in white blood cell levels. I hope this helps kind of like lay it out, challenged you to kind of like know the difference between the two. And you could also see here how, the penias, that means decrease, and the cytoses mean increase. So hopefully that will make it easier for you guys to remember the difference between those two. I remember seeing these in practice questions or while I was studying, and at first I was getting them wrong because I didn't know they were different. So, hope this helps. Thank you again for joining us on Journey to 600. Please like, subscribe, and turn on our notifications. Also, I'm very sorry for my low, croaky voice. I'm currently getting over a cold. So, if you've made it this far, I really appreciate you listening to me.